This presentation will provide an in-depth exploration of the essential minerals necessary for optimal health and well-being. Calcium helps in muscle function, nerve transmission, hormone secretion, and blood clotting. Sources include dairy products, leafy greens, and fortified foods. Total calcium in the human body is 1 to 1.5 kilograms, 99% is seen in bone and 1% in extracellular fluid. The daily requirement of calcium for child is 1,200 milligrams per day, and for adult it is 500 milligrams per day. During pregnancy/lactation, the calcium requirement is 1,500 milligrams per day. Effects of calcium imbalance: hypercalcemia, anorexia, nausea, vomiting, polyuria, polydipsia, confusion, depression, psychosis, renal stones, osteoporosis. Hypocalcemia, deficiency of vitamin D, deficiency of parathyroid, increased calcitonin, deficiency of calcium intake. Iron, essential for the formation of hemoglobin, which carries oxygen in the blood. It also supports metabolism and immune function. Good sources include red meat, beans, and fortified cereals. Total body content of iron is 3 to 5 gm, out of which 75% is recorded in blood and rest of them are recorded from liver, spleen, bone marrow, and muscle. The normal limit for iron consumption is 20 mg per day for adults, 20 to 30 mg/day for children, and 40 mg per day for pregnant women. Anemia. Anemia is the most common nutritional deficiency disease. The main causes of iron deficiency or anemia are nutritional deficiency of iron, lack of iron absorption, hookworm infection, repeated pregnancy. Magnesium. Involved in over 300 enzymatic reactions in the body, including energy production and muscle function. Can be found in nuts, seeds, whole grains, and leafy vegetables. Optimal level of magnesium for human consumption ranges 300 to 400 mg/day. The main source of magnesium includes cereals, beans, leafy vegetables, and fish. Potassium. Vital for maintaining fluid and electrolyte balance, as well as supporting muscle contractions and nerve signals. Bananas, potatoes, and citrus fruits are excellent sources. In healthy individuals, low potassium levels may inhibit the kidney's ability to reabsorb calcium. High calcium levels in the kidneys can result in kidney stones. Zinc. Essential for immune function, wound healing, and DNA synthesis. It can be obtained from oysters, red meat, poultry, and fortified cereals. The daily requirement of zinc for human consumption ranges 10 mg/day. Copper. Total human body contains about 100 mg of copper and are encountered in muscle, liver, bone marrow, brain, kidney, heart, and in hairs. The normal copper limit for human are 1.5 to 3 mg per day. The main sources of copper are cereals, meat, liver, nuts, and green leafy vegetables. Fluoride. In India, fluorosis is widespread in Punjab, Rajasthan, Delhi, and Tamil Nadu. Fluoride-rich source includes sea fish, cheese, tea, and jowar. Fluoride is well known for their protective effect on caries. The safe limit of fluorine is about 1 ppm in water. But excess of fluoride causes fluorosis. Fluorosis is more dangerous than caries. When fluoride content is more than 2 ppm, it will cause chronic intestinal upset, gastroenteritis, loss of weight, osteosclerosis, stratification, and discoloration of teeth. Manganese. The normal limit of manganese for human is 5 mg per day. The major source of manganese are nuts. It is considered an essential nutrient because the body requires it to function properly. People use manganese as medicine. Manganese is used for prevention and treatment of manganese deficiency, a condition in which the body doesn't have enough manganese. It is also used for weak bones, osteoporosis, a type of tired blood, anemia, and symptoms of premenstrual syndrome, PMS. Absorption of minerals. Mineral absorption is normally proportional to dietary intake, with two important distinctions: the absorption of iron and calcium, both of which can be regulated according to the needs of the body. Iron absorption occurs in the duodenum and proximal jejunum. Following digestion, iron is in two forms. Conclusion. In conclusion, understanding the importance of these essential minerals is key to maintaining overall health and vitality.